Good morning, I'm Paul Lisnick.
Good morning, I'm Tamon Bradley. Welcome to WGN-TV Political Report. Coming up.
Our federal investigations of corruption in Illinois are ongoing. We have a lot of work ahead of us, and we will get that work done.
ComEd caught by the feds, the criminal case that puts public official A on notice.
We cannot control this situation without masking and distancing. We cannot.
Fighting back against another major outbreak. We're talking with Illinois Public Health Director Dr. Ngozi Ezike about the state's new plan to combat COVID-19. Plus, a turning point in Chicago, the warning from city leaders about a rise in COVID cases and the road to recovery.
We begin this morning with the ongoing COVID-19 pandemic. The state of Illinois has surpassed 150,000 confirmed cases of the virus and more than 7,000 deaths.
3 weeks into phase 4 of the governor's reopening plan, cases are on the rise again. Some of that was expected as Illinoisans venture back into some parts of their normal lives, but the public health department is switching strategies, dividing the state into 11 closely monitored regions to ensure there won't be another massive outbreak.
Illinois Public Health Director Dr. Ngozi Ezike joins us this morning to talk about what comes next. Thank you so much for your time. Welcome to Political Report.
Thank you for having me. Hello.
Hi. There was a time, doctor, when 40,000 cases per day across the country was alarming. This week, the United States topped 70,000 per day. What is the country doing wrong, or was this just inevitable?
Well, I think at the foundation is that we need a national strategy. You know, the 48 states are contiguous. Illinois alone is bordered by 6 different states. So even if you do everything right in one state, in 2 minutes you can be in another state, and those people can come back and forth, and people do fly back and forth. We're seeing a lot of cases that track back to travel to quote hotspot states. So, you know, I feel like there needs to be a national strategy so that we can all coordinate our efforts to get this right together, not have some people be in a good space and then another place blows up and then it spreads. So some of that is at the foundation, and so looking forward to the leadership that we will need to try to coordinate this. But I am happy with what we've done in Illinois. We're fiercely trying to protect it, but it needs everybody's cooperation, every single person in Illinois and people visiting Illinois.
Dr. Ezike, you and the governor often talk about your reliance on science and data. What is the most important metric that you look at every day to determine the direction the state is headed?
The number of people wearing masks. That is an important thing. We don't have a very scientific way to measure that, but at the bottom line, what we don't want to have a situation where people are sick and they can't get care because there's not an available ICU bed, or there's not available, general medical surgical bed. We need to make sure that we have enough beds to take care of the people that may need care. But as we always say, and we want an ounce of prevention is worth a pound of cure. So instead of just thinking about how we can treat people once they get sick, let's really focus our energy and our efforts on helping people not get sick in the first place.
Dr. Ezike, during the early days of the crisis, we did not have a mandatory mask order. It was just strongly advised. Was it a mistake not to order people to wear a face covering? And what do you say to Americans who just simply believe it is their freedom not to wear a mask?
Yeah, so I think there was maybe some miscommunication in that I think we know that masks are helpful. Obviously, our medical staff uses masks, and that's why we have seen them largely fare quite well with respect to this epidemic. I think the issue is that there was a shortage. There was a national, take that back, international shortage of the supplies, and trying to prioritize which group needed to use it would be the healthcare workers, on the front lines, and making sure that they had the masks that they needed to keep themselves safe as they were dealing with people in the hospital. And so as this issue has obviously, this pandemic has grown and progressed, yes, we know that we can do source control. We call that source control when you're trying to keep viral droplets from being expelled out and reaching other people. We know that we can control that by wearing some kind of face covering. And so obviously it's a cultural shift for us here in Illinois and this country in general. We know that other countries in Asia, this is something that's routine. Sometimes we'll see that when people are visiting from other places where visitors from Asian countries may routinely wear masks, but it's a new concept for us. But we're really trying to promote it aggressively, and we really want people to take advantage of the knowledge that we have that these face coverings can help control the spread. And we need to do that if we're allowed to congregate and move around and gather more. We can't do that without the face coverings and of course, the distancing.
So, Doctor, we look ahead, of course, to the new school season, and Mayor Lightfoot on Friday let us know what her plans are at this time. Governor Pritzker earlier in the week said, get ready for a very unusual summer. How flexible do things need to be between now and when schools actually open up? How
flexible? Well, I think the whole premise of the new plan is to be very nimble and be able to react to whatever is happening. And so although we did a very important step in doing the statewide approach to have the shelter in place, stay at home order, and that was necessary just to make sure that we brought statewide the transmission levels down. Now we put ourselves in a good place. We're one of only maybe 17 states in the country that are under a 5% positivity rate. So to be able to protect that now, we're looking at the data so closely every single day. I spend hours with the data team looking not just at these new 11 regions that we've created, but even going down to each individual county, even delving further into sub-county levels, trying to figure out why does this city have 15 new positives? What happened there? And calling the local health official, talking to city officials, just trying to see if we can just make these surgical strikes right where the area is just starting to get hot before it spreads and becomes a bigger problem that needs more widespread action. So that's the approach we're taking now. Again, we're trying to avoid letting things fester until it got to a region or statewide. And we're hoping, with the great collaboration between IDPH and the local health departments, that we can attack things while they're still just small flames and make sure we don't start a fire.
Doctor, we know you're focusing on particular things such as youth sports, but what does the science say about bars, both gathering inside of a bar and beer gardens? Are those of particular concern to you?
Yeah, so what we know, again, we call it the novel coronavirus for a very specific reason. It is brand spanking new. We've only known this new enemy that we're dealing with since this year, as far as we know. So trying to stay ahead. We're watching what the science and the data, what it comes out and what it tells us. We know that indoor spaces are more problematic than outdoor spaces. And that kind of makes sense when you think of the amount of airspace and the ability to dilute these droplets as they get expelled from someone's mouth or nose. So we know indoor is riskier than outdoor. We know that the more people you're in contact with, the higher the chance, assuming that everyone has an equal chance to be infected, the larger the gathering, the larger the crowd, the more chance of you running into someone that's infected. So then a larger gathering is obviously more risky than a smaller gathering. We know that, these droplets spread, and so the closer you are to someone, the more likely you are to share it with someone, the more likely you are to receive it for someone. So then when you think when you put those pieces together, it's not a big leap to understand that an indoor crowded space that doesn't allow for spacing, that doesn't allow for great air exchange because it's enclosed, no windows, no doors open, that those are going to be high risk areas. So whether it's a bar or in some other kind of indoor dining or any other small enclosed space, we're keeping a close eye on that as really potential hotspots. And there have been several stories that have supported that. But I won't limit it to indoor restaurants and bars. We have seen clusters of outbreaks in every type of setting, from churches. You mentioned something about sports teams, private parties, gatherings. We've seen it in workplaces. We've seen it really in stores. We've seen it in every single setting. So there's no setting maybe that's really immune, but we want to arm everyone with the information they need to decrease their chances of contracting the virus.
Dr. ZK, thank you. We'd asked you to translate our entire interview into Spanish because you do that every day.
We know you're fluent.
But we don't have time.
Anyway, thank you.
Thank you.
Thanks for the work you're doing.
Thank you so much. Thanks for having me.
Coming up next, the price of influence at the Illinois State House. We're talking about the corruption case that has dubbed the most powerful politician in the state Public Official A. And later.
This is our moment of reckoning. This is our moment of whether we're going to do the right thing.
A stern warning for Chicago. The mayor threatens to send the city back inside while city council plans ahead for an eventual economic recovery. Stay with us.